Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I have the privilege today of bringing you our liver cancer lesson. Today we'll be talking about social and emotional support with Elena Salamando, who is a licensed oncology social worker based in Orlando, Florida. Elena, welcome and thank you.
Thank you for having me.
For liver cancer patients and their family members, what types of issues do they face? What types of challenges do they bring to you every day in your work?
So with liver cancer, some challenges that a patient and their family may face is how to navigate living their life while having a diagnosis of cancer and while also going through treatments for liver cancer. So some issues that they may present and seek me for is how do they speak to the children about their diagnosis? How do they manage their work, their personal life, their relationships with their spouses and with their family members? Some issues may come up such as far as end of life concerns, fears of end of life, some existential issues that may rise because of a diagnosis. And essentially, how do you integrate your diagnosis, your treatments, and your personal life into one? And so managing that can be really overwhelming. And one of the services that I provide is to help them iron all that out and help them live their life while they have a diagnosis.
We know there are as many types of liver cancer patients as there are people, but some liver cancer patients have been living with different types of liver disease, whether it's hepatitis C or with NASH for some time before their diagnosis with liver cancer. And some, far too many liver cancer patients are only diagnosed very late in their disease. It's, through perhaps an incidentaloma, just to me a heartbreakingly careless term, where the health system or the doctor may have been looking for something else and notice on a scan that there is a tumor or liver cancer presence. And so the first time they're hearing about any liver disease, let alone cancer, maybe with that cancer diagnosis. So can you tell us a little bit about sort of the differences that it seems in the reactions and the coping mechanisms for someone who has had some time to adjust to thinking of themselves as a liver patient versus someone who the diagnosis with liver disease and cancer come right on top of each other?
Yeah, you're absolutely right. With liver cancer, it may be diagnosed later on and the prognosis may be poor. And when that happens, some of the emotional reactions that I see is shock, surprise, confusion, especially if they've been under the care of a physician for other liver issues. They may have felt that they were doing everything possible to get ahead of the game, so to speak. And then to just suddenly get diagnosed with a poor prognosis of liver cancer can be really shocking to the system. And when that happens, that's where a professional like myself, an oncology social worker, can really help them understand the differences between having cancer to having other type of medical issues. If a person has been having liver issues for quite some time, they may have some anger, some resentment, some confusion as far as how did this happen, especially if they've been complying with their treatments and following all the recommendations. And it's important to really educate them on what cancer is and how it may be different from what they've already been experiencing, even if it was in the same organ.
I've spoken with several patients and patient family members, particularly those who have a diagnosis of liver cancer and have been recommended for transplant, which surgery and transplantation are really the only ways to cure liver cancer, although now we have many different types of treatments. And some become so resigned or guilty or depressed that they don't want to move forward with a transplant, even though their doctors recommend that, and they are eligible for that. So can you just discuss some of these swirling set of issues where that may be barriers to people even accepting the help and the care that is available to them?
Right. So what may happen is grief. A lot of people think that grief is only when someone close to you dies, but the grief reactions can occur when something has just changed in your life. And when you go from, let's say this person may have been working, a family member, they have their roles as far as their personal life and their work life, and then they have to shift that to maybe ending all of that to prepare for transplant. There can be a lot of grief reactions that occur with that. The grief of having to end work, or the grief of the financial stability that they may have experienced before needing to get a transplant. There's a lot of parameters that come with getting a transplant, and a lot of requirements that the medical team will put on the patient and the family, such as having a 24/7 caregiver for a certain amount of time. And if that person may not have a caregiver or may feel guilty over that, that may impact their decision to move forward with getting a transplant. So what I have seen is a lot of people just feeling grief over what their life was the day before they got the diagnosis, or the day before they got the news for the transplant, to what their life may look like moving forward without them not having much information about that. So a person may know, I need to get a transplant, but not really know what their future looks like, which can create some anxiety. And if some of that grief and anxiety is really high, it may immobilize that person to not make a decision or not move forward, because there's that fear of the unknown, the feelings of guilt that they may have for even having cancer or having to have a transplant, and what that may do to themselves and to their family and their social circle. So there's so many different types of emotions that may be running through this person's mind that may just immobilize them from making a decision. And we are able to just talk with them and listen to them and maybe help answer some of their questions, or challenge some of their beliefs that may not be accurate.
Living with both a diagnosis of liver disease, and in so many cases, those are hard fought, hard won diagnoses even to get, let alone living with the stigma, and the just the logistical challenges and the symptoms of liver disease, combined with, as you so articulately put, issues of grief or guilt or depression or confusion, and trying to navigate cancer on top of that. Those are big loads for patients and families. And so I look forward to talking with you in the next liver cancer lesson about the services available to people to help them deal with all of that and surmount all of those challenges. But thank you for this conversation today, Elena.